Training for an endoscopic spine surgery procedure does not begin in the operating room. It starts much earlier with selecting the right simulator. As our audience is well aware, endoscopic spine surgery relies on different approaches, which are mainly defined by the access route and the level of the spine where the procedure is performed: cervical, thoracic, or lumbar. Among the most commonly used approaches are the transforaminal, the interlaminar, and also the extraforaminal approach. The question that you may ask yourself is, what simulator does Realists have for each of these cases? Stay with me and we'll be answering this question. Each of these approaches poses different technical challenges: spatial orientation, instrumental control, and a precise anatomical understanding in a minimal invasive environment. However, when talking about endoscopy, we start from a clear basis. Endoscopy is defined by three fundamental elements. First, the use of the endoscope as a primary instrument. Second, direct visualization on screen from an endoscopic channel. And third, working with a closed visual field with continuous camera control. Therefore, the RealSpine SI sacroiliac and the RealSpine spondylumbar simulators are excluded at this stage, as they are geared toward percutaneous, open, or the microscopic approaches. Our RealSpine simulators for endoscopic are especially designed for training in lumbar endoscopy, supporting interlaminar, transforaminal, and extraforaminal approaches, and allowing us working in both single port or biportal procedures. Now, let's take a closer look at our simulator and has to offer. The anatomy is built in layers. You are not only seeing structures, you are working through them. Skin, soft tissues, ligaments, structures, and bone all behave differently when the instruments are introduced. This becomes especially relevant once you start working with your endoscope. Instrument interaction is constrained by the channel, just like the rear endoscopy. You don't have unlimited freedom of the movement. Every action has to be deliberate. What the model reproduces very well is resistance. You feel when you're working against soft tissue, when you reach bony structures, and when you need to adjust the pressure or angle. Very important information. Of course, if we have a simulator, we integrate pathology. In terms of pathology, the endoscopic models allow training scenarios such as a lumbar herniation or stenosis conditions. Very important to know, in this model, we have 4 herniations left and 4 herniations right. And you can also have some stenosis pathology in every level. Here's the main advantage of the models. You need to recognize the structures on the screen, identify pathologist tissue, and decide how to proceed, like in a real operation, all with a limited visual field, of course, the endoscopic. This is where the simulator becomes particularly valuable. You can repeatedly train camera control, deep perception, and hand-eye coordination without time pressure. The endoscopic model also supports both single and biportal workflows. This directly affects how instruments interact with the working space and how the coordination is trained between visualization and manipulation. These differences may seem subtle, but they have a major impact on procedural flow. And this is exactly the kind of detail that benefits from repetition and simulation. So, what you're training here is not just a movement pattern, but a complete endoscopic workflow: access, orientation, tissue handling. That's why advanced simulation becomes a key part of mastering spinal endoscopic with confidence. Thank you for staying with us until the end of this video. Follow us in our social media and on this channel, where we will continue to share valuable information to help you improve your training.